Hello and welcome back or to the channel if you're new. First off, I am going to address the elephant in the room, and that is this whole thing going on up here. I know, it looks terrible. I haven't had time to get a haircut because I'm currently in my exam period in the semester. And that's also why I haven't really been posting on YouTube, which I do apologize for. I'm hoping to be a lot more consistent now that I've kind of got two big exams out of the way. And I was just thinking that I'm going to post this video now that I have a little bit more time on my hands to break down kind of what's been going on in the last few weeks of my life, and then also kind of give you guys a bit of an insight as to what the exam period's like in medical school, especially at the University of Pécs. Okay, so I'm not entirely sure when last I posted on this channel. I know it has been absolutely ages. So that was probably around the time when I started realizing just how much work I was going to have to get through, and I think the stress started kicking in. So I had to actually fall out of the routine of posting, and that I actually am really sad about, I guess, because I was getting into the swing of things and I had a rhythm and I was seeing the progress. I feel very rusty right now. Talking to the camera feels very awkward again. So excuse, you see already. I apologize for the rustiness, and hopefully I can get back into the swing of things quite quickly and kick into gear now that I have a bit more time on my hands. Okay, so with that said, let me give you guys a basic outline of what I want to discuss in this video, and then also a brief idea of what I want to do with the channel in the coming weeks and months when I am fully finished with all of my exams and I can get the consistency back. So I want to start the video just by discussing briefly what the process was like and what the exam was like and how it all worked with regards to pathology and pathophysiology. Those are the two big exams I've managed to pass, luckily. And then give you guys an idea of what I'm kind of doing now, studying for microbiology, and I've got a public health exam as well. These are the last two I've got left in this exam period. And in the summer, I actually have summer practice for 2 to 4 weeks where I'm going to be working in the angiology department. Quite strange, I know. I'm going to mention why that's the case in the video, but I'm going to be working in the angiology department, and I'm hoping to maybe get a bit of footage and give you guys an idea of what the life is like in the hospitals here in Hungary, specifically in Pécs, in that video, because it'll be quite cool to give you guys something other than this common setting that you are used to. So let's dive into the video, I think. Okay, so for those of you that are new, let me give you a bit of context before I dive into the exams themselves and just give you an idea about how it works here at the University of Pécs and I guess medicine in Hungary. So we have a 14-week semester and then we have a 7-week exam period, which is quite a unique system. And then in that 14-week semester, we don't have many exams. It's kind of preparation and self-study and getting yourself ready for the exam period. But around 13th week of that semester, the portal system at our university will open at a specific hour for registration for all of the exams. And that means that all the students are going to be online at the same time. The server is very slow and it can get really stressful because everyone's trying to register for exam places. Everyone has their own schedule and they're kind of trying to get their ideal schedule. And you can end up in a scenario where you're registering or trying to register for an exam and it gets full just before you can register, and then you have to reshuffle, and it's a whole stressful thing. But it is a cool thing that we all get to make our own schedule and that it isn't predetermined for us. So there's usually limited places every day because most of our exams are oral exams, and then there will be a few written exams we have as well, like the microbiology I have coming up next, where that at least can be for the full group and they do that once a week. So that you won't really struggle to get places for, other than the patho and pathophysiology where there were limited places and it's kind of a dogfight to see who can get them. Okay, so with all that said, I know I probably said it quite quickly, I hope you could follow, but I ended up choosing to go with pathology first because pathology is our big exam of this year. So it's the exam that makes the most sense to try to get out of the way first, because if you do, it really opens up the exam period for you and lowers the stress levels to give you time to kind of complete the rest of your exams. So I registered for pathology. I didn't get any spaces in the first week. So I actually ended up registering for, I think it was either the Monday or the Tuesday in the second week. I've already forgotten, but I'm pretty sure it was the Tuesday, second week. And yeah, that meant that I had from maybe the 13th or 12th, 13th week of semester up until that date to really try and, I guess, cram in the work. I was trying to learn it throughout the semester, but the nature of pathology is it's so much memorization that even if you've read it once during the semester for understanding, when it comes to studying it in that period, it feels like you're reading it for the first time because it's so many names and so many different diseases that it really is difficult to try and memorize and get into your head. So I started working through our, I think, 84 topics and relative histological slides, and obviously it started getting closer and closer to that point where I felt like it was absolutely impossible and there was no way I was going to pass this exam. I don't even think I managed to get through everything twice. I wanted to, but in the end I had to kind of do that speed reading that medical students do for maybe like 3 of the chapters, where you just okay, I hope, oh no, don't know that, oh well, don't have time, and you just move on and hope that you don't get that as one of your topics in the oral exam. Let me give you guys an idea of what the exam was actually like, because at least that's the nature of this third year. In the first 2 years at the University of Pécs, it can be quite traumatizing. I've mentioned in some previous videos that I think they use the first 2 years to weed students out, and the exams definitely seem a lot more difficult. Not so much because of the content, but because of the actual examiners and how much they expect of you. I think in this year now, you kind of gain a little bit more respect in the university. So examiners kind of treat you a little bit more, not an equal, but they show you a bit more respect, and the exam's a little bit more of a conversation rather than like a drilling. So the exam is, in most cases, a lot better than what the studying is actually like. And sometimes you feel like there's no way you're going to pass, but you get in there and they kind of, with the questions they ask, can get the information out of you. So that's a cool thing, I guess, with the oral. It gives you time to think about your answers, and they can ask their questions in different ways as well, which you wouldn't get in a written exam. So it's definitely a very strange, unique way of being tested. The day before your exam, you'll receive some kind of email that tells you where you need to go, like what room and roughly what time you need to go. And then it also tells you which examiner you're going to get. And this has a very big influence on your psychology, I guess, going into the exam, because there's always certain examiners that have a notorious reputation of kind of being strict and failing students. And it's not really a good thing to get into your head. It's probably better to just ignore that and say, if I know the work, I know it and I'll be fine. But it's one of those things where it's easier said than done. So you receive that list and you're immediately looking through for the names and you're like, oh my word, please don't give me that examiner. I really want this examiner, and so on. So I received the list, and luckily for me, I didn't get the really strict examiner within the department. So that immediately kind of lowered my nerves a little bit. But I did know that it was going to be a very challenging exam if I picked topics that weren't good. So that was kind of the day before. Stress settings, speed reading, trying to see what I could do in the last few hours, and then kind of knowing I had an examiner that wasn't as strict. Exam day comes and I'm absolutely exhausted. I don't know what it is, but the night before an exam, I just cannot sleep. I keep kind of zoning in and out of light sleep, and I just can never get a good night's sleep. So I was absolutely shattered. And then you sit outside the room and you have all this adrenaline going because you're waiting to go in. And with an oral exam, it's so much more stressful than a written because there's so much variability. Again, you're a little bit uncertain about how the examiner is going to treat you and how strict they are, especially if you haven't been examined by them before. You're worried about what topics you're going to draw. And then on top of that as well, you're worried about how you're actually going to be able to answer their questions, or if you're going to go blank when you receive the topic. So there's so much to think about that it's more stressful kind of waiting than it is to just get in there and kind of see your fate. So I was waiting. Eventually I go in, I draw out my envelope, and in this exam we get 2 theoretical topics that we draw. We have one macro preparation, which is basically like a glass container that contains some kind of organ, and that organ has some kind of pathological issue with it that we'll have to explain and analyze. And then we have one histological slide as well, and that slide also obviously has some kind of pathological issue which you will have to explain to the examiner as well. Now I walked in, and the examiner I got was actually a hematopathologist as his specialty. So getting hematology or hematological topic was something I was dreading, because even though I kind of felt like I knew the stuff, it's so much detail and it's quite easy to forget some of the intricacies and maybe mix some things up. And of course, the first topic I'll pull out is acute myeloid leukemia and myelodysplastic syndrome. As soon as I read that, I thought, oh my word. I could only remember 2 pieces of information that I knew were quite high yield, but a lot of the kind of small stuff around it I wasn't sure about. So I knew it was going to be difficult when he started questioning my knowledge. And then the other topic I was quite lucky. I got cerebrovascular diseases and intracranial hemorrhages. So that one's at least not so much focused on pathology in terms of a bunch of different diseases. It's more kind of explaining the stroke and different types of stroke that you can get, as well as obviously a few different types of hemorrhages. It's not really a disease or tumor heavy topic, like for example, some of the tumors within the central nervous system or some of the tumors within the reproductive organs. Those topics are a lot more difficult to work through because there's maybe 10 different tumors that you have to kind of tackle. So I was quite happy with my topics, but I was also a bit scared, as I mentioned, because he was a hemopathologist. When he came and sat next to my chair and kind of started the exam, we luckily started with the macro preparation, which for me was basically a gastric cancer that had spread to the ovaries, and it was in a preparation. And I knew a lot about that, so it was a good start to the exam. I could kind of start talking about that and ease my way in and show him that I at least know some knowledge and I have studied. And then I moved on to the histological slide, which was of the thyroid. It was Graves' disease, which is also something I was able to speak about quite a lot. So I was quite happy with both of those two because it just set me up for some of the mistakes I was going to do later. I think it just gave me a bit of money in the bank. So then we moved on to the acute myeloid leukemia, and as I thought, I gave him the details, but then he wanted kind of some of the very basic things that you tend to read over sometimes when you get very fixated on details during your studying. So kind of age groups that get affected, kind of how you differentiate the two in terms of clinical symptoms. And these are the kind of questions where I was getting really stumped, and he was having to help me through a little bit, and I was definitely making mistakes. But at least that's, as I've said, that's the nature of this exam, and they understand that you're not going to know everything in the 560 pages. So as long as they can see you have a basic understanding and then you can work through things, in the end, it should be fine. The thing you want to avoid is blanking out on topics, because if you blank out on topics, there's not much they can do for you. They're going to have to fail you in that sense, and then you're going to have to come back and try again. It's probably something I should have mentioned in the little lead up to this, is that we get 3 chances for every exam in the relevant exam period. So if you do fail once, you do have 2 more chances. It's not the end of the world. It's quite a cool setup that we do have. Some people might think that that's awesome. How's it possible that you have 3 chances in medical school? That's a bit insane. But these exams can be really, really unlucky if you get a topic that's not good, or maybe you're just not quite prepared. It's not that difficult to fail. There are many cases where you can fail. So having those 2 extra chances are helpful. But at the same time, it can happen where you get very unlucky the first time. The second time, you know that you have only one more chance if you fail. The stress builds a little bit. And if you get a little bit unlucky again, a strict examiner, or you blank out a bit, very quickly you can work through those 3 chances that you get. So yeah, luckily I was able to get through the patho exam on my first chance, and I was very grateful for that. And then we moved on to pathophysiology. Pathophysiology is a subject I enjoy a lot more than pathology. It kind of involves more connections and intricacies within the body, and it's not just a simple kind of list of the disease, the symptoms, the prognosis, the kind of age group, and then the next disease and the next disease. It's a lot more kind of digestible information, and it's more understanding. So I really enjoyed studying it because you can kind of get your core knowledge and then know that if you go into an oral exam and he asks you a question, you can probably figure out the answer if you really have that core understanding there. And that's kind of exactly how the exam ended up turning out. Before I got to the exam, I had about 6 days because I was still kind of in like this lull after patho where my brain just wasn't working and I wasn't able to ease into the pathophysiology studying as quickly as I would have liked. But then I was very lucky that I had a friend who was also currently studying for pathophysiology after passing patho. So we ended up deciding that we were going to study together. And for 2 days, we managed to work through so many topics, probably about 40 or 50 topics in those 2 days, just walking around the city with an iPad like crazy people, talking out the topics. I remember we even left around 7 p.m. from her apartment, and we walked all the way around the city, and we realized that we were going to need something to eat, but it was getting later and later where nothing would be open. And we ended up walking to Burger King at like 11 p.m. We were sitting at the Burger King, eating our burgers while talking out medical things as well. I'm sure everyone was just looking at us like these guys are the biggest nerds on the planet. And yeah, I explored parts of the city I've never seen before just during this whole process, because we were just trying to like get the blood circulating and keep ourselves awake with how much information we were trying to cram in. But it was really helpful to have someone else there to force me through the work. And because I covered so much with her in those 2 days, the rest of the days before the exam period, I could kind of ease my way through the rest of the topics and practice the ECG, which is a very important component of the pathophysiology exam. Now, I got into the pathophysiology exam, which was about 2 days ago from the day I'm filming. I'm not entirely sure when I'll post because I do still need to edit. But I got into the pathophysiology exam, and you get some preparation time. Again, same with the patho. You get some preparation time when you receive your topics and the ECG, about 40 minutes or so, to kind of write down some notes and make sure that you at least somewhat prepared for when you go and meet the examiner. And I got my ECG, again, same as last semester, wasn't entirely sure of the diagnosis, which is a bit stressful. I could tell it was either atrial fibrillation or atrial flutter, but it was one of those ones where I was a bit undecided. And it, of course, out of the 50-50 decision, I ended up making the wrong one. And I said to the examiner, I believe it's atrial fibrillation. As soon as I said it to him, I saw his eyes, I was like, okay, I thought it was atrial flutter. And then I immediately tried to correct myself. And he was then happy from then on. And we kind of managed to get through the ECG, asked a few questions to test that I did know what I was talking about and the understanding of the ECG. And then we moved on to the case study, because there's a little case study before our 3 theoretical topics. And in the case study, it gives you a brief outline of a patient's history, some of their blood values, and then it asks you basically to try to figure out what the diagnosis is. Quite an interesting thing for us because we haven't practiced it much during our first 3 years. It's kind of a new thing for us. And yeah, we had to kind of digest it and work through and bounce some ideas off the examiner. He would help us with some of his questions. And I managed to finally get that diagnosis, which happens to be Addison's disease. Don't think that has much relevance to you guys, but yeah, adrenal insufficiency. And the patient ended up having high potassium as a result of that, and ended up having, unfortunately, a cardiac arrest because the hyperkalemia or high potassium levels can cause a ventricular fibrillation and then sudden heart attack. So that's the case study that I had. And then after that, we went into the 3 topics. I got quite lucky with the topics. It was a very good card, a card that I knew pretty well. So it went quite smoothly. Other than this one thing, I got hypertension as one of my topics. And I was kind of thinking in so many details again. Your brain just goes so blank on some things that the examiner has an idea of what they want you to say in their head. And you just cannot for the life of you figure out what the examiner wants. It got to a stage where he was like, look, I know you know your work. I want to give you this good grade. But before I can give you that, I need you to just say this. What's this basic dietary reason for having hypertension? What can you consume that's going to lead to hypertension? And I just was thinking so many things other than the thing he wanted. I was thinking like protein consumption causing different things. I was explaining how glucose can interfere with insulin, which can interfere with lipids, which could interfere and lead to hypertension. And he just wanted one basic thing. Eventually he ended up saying salt. And I was like, oh my word. It was this whole roundabout for me just to say salt, and I could not for the life of me say it. And at least it was a bit of a cool joke. He kind of just said, well, do you not have salt in South Africa or something? And I was like, yeah, no, we only use pepper. So I didn't know about that. And we laughed and kind of joked about it and moved on. But sometimes that can just happen in oral exams where the idea that they have in their head that they want you to say, you just can't figure out. But yeah, it was a cool exam experience. I luckily passed that 2 days ago. Now I'm on to microbiology and then public health. So nearly done. And then I can start, as I said, getting consistent again. I don't know how much more detail I'm going to go in because I don't know if you guys are really that interested in the intricacies of these exams. I might have already made a lot of you bored and you probably clicked off the video. But I guess if you've made it this far, you are somewhat interested in what the process is like. So microbiology is obviously just studying about bacteria, viruses, parasites, and fungi. So I'm currently in the process of figuring all that out. We luckily have the resource Sketchy. If any of you are medical students watching and you don't know about Sketchy for some reason, you have to look into it. It's amazing. So yeah, we have Sketchy Micro. He basically has like all these drawings that he makes for every single bacteria, every virus, and so on. And they're so detailed. And then he has videos that kind of really help with photographic memory. So it's a lot nicer now to study. It's a bit of a switch up than just reading pages and pages of notes. Now I can kind of look at pictures and watch some videos, and it's a nice break because my brain, I feel very burnt out, and I'm definitely just looking at the summer now, and I'm on fuel. I'm on the last few fumes. I'm just kind of pushing towards the end. So I'm grateful for the resource, and that's kind of what I'm doing at the moment. Started with bacteria, and I still have a lot to go, but the exam is going to be on the 9th of June. And then hopefully I pass that. If I don't, I'm going to have to reschedule for the week after. And then I do currently have public health registered for the 13th of June. So if all goes well, I could be done then, which will be awesome. Public health is, it's one of those exams where we all studied maybe a day or two before, and you kind of have to pull some stuff out of places. And, in July for that month, I've got summer practice. And as I mentioned, I'm going to be in the angiology department. That happened from a similar reason that I was explaining with the portal system and registering for exams. I kind of had a bit of a panic because I forgot how it all worked with all the different steps. And then I kind of, by the time I figured it out, all the places for what I wanted were gone. And then I kind of had this whole panic where, I mean, I wanted hematology and I tried to get that with my friend. He got the place because he kind of was able to follow the steps. By the time I figured it out, the places were gone. And then I think I tried to register for traumatology and that didn't work because again, I made a mistake. I registered for it and clicked save, but I forgot that you have to actually finalize it to still book the place. So I clicked save, I closed it, I was like, okay, I got something. Messaged my friend, I was like, yeah, I'm not with you unfortunately, but I have this other one. And then he just went, did you finalize it? I was like, went back on the system, checked, places were gone. So then I just was desperately looking for something. And angiology department popped up, so I was like, I guess, and I registered for that. So I have no idea what to expect. I think it's quite strange because I never expected angiology to have its own department. I always just thought that angiology would fall under the cardiology ward, because it's kind of just dealing with vessels and you'd think that cardiologists would handle that as well. So I'm not really sure. It seems like it's a very fine niche department, I guess, in the hospital here. But it's still going to be interesting. I know sometimes summer practice in Hungary has a bit of a bad reputation because some of the nurses and the doctors don't speak English, and of course a lot of the patients don't speak English. So as an English speaking student, it's quite hard to get the practical skills and get involved. But I think if you show the effort and you basically go to the doctors and almost force yourself on them, like to kind of say, look, I really want to learn, please, and I really get involved, then I'm sure they'll help you out. At least that's what I've heard. So I'm going to try and be as proactive as possible, get as involved as I can. And as I said, maybe hopefully film some things and give you guys a little bit of insight into hospital life. So that would be cool. Stay tuned for that. And then I also really would like you guys to let me know if there's any specific videos you'd like me to make regarding the university, regarding the city. I know a lot of people are going to be maybe searching up Pécs or University of Pécs kind of now in the summer if they're coming to study in the new semester. So if you do come across this video and you want to know something and something specific, or you just have a question, then let me know in the comments below. And yeah, we'll see where the channel goes. I apologize again for not posting for so long, but I'm definitely going to try and be consistent from here on out. And yeah, thank you for watching. I'll see you guys in the next one. Cheers.